Alright, so I'm about to begin my head to toe. I just wanted to show my blank sheet before we started. I'm going to set that right there. Hello.
Hi.
How are you today?
I'm good. How are you?
Good. I'm Alexis. I'm going to be your student nurse today. I'm just going to wash my hands really quick. Could you start by telling me your name and date of birth?
Alyssa Grzymkowski, September 28th, 2001.
Okay, great. And then do you know where you are today?
The dorms.
Great. And then could you tell me what year it is?
2021.
Okay. So we're going to be doing a head to toe assessment today. I'm just going to be looking at your whole body from your head to your toe. Are you okay with that?
Yep.
All right. So before we start, I'm just going to ask you some questions about your health history.
Okay.
Do you have any allergies?
No.
Are you prescribed any medications?
Just birth control.
Okay. And what form of birth control is that?
Oral.
Okay. So you take that every day?
Yep.
Okay, great. And then are you sexually active then?
Yep.
All right, but are you safe? Okay, great. Do you take anything over the counter besides the birth control?
No.
Okay, how often do you drink?
I don't.
How often do you smoke?
I don't.
All right, and then do you use any recreational drugs?
No.
Okay. Have you had any surgeries?
Nope.
Any diagnoses that we should be aware of?
No.
All right. When was your last menstrual cycle?
About 2 weeks ago.
Okay, good. And is that pretty regular?
Mm-hmm.
All right, great. And then are you in any pain today at all?
No.
All right. Well, I think with that we can get started. So the first thing that I'm going to do is get a set of vitals from you. Are you okay with me touching you today?
Mm-hmm.
All right, so I'm just going to roll up this sleeve. And then some other questions. How would you say your diet is?
It's pretty good. I mean, I usually, for the most part, eat 3 meals a day.
Okay, good. And that's pretty healthy, you'd say?
Mm-hmm.
And then how often do you exercise, or how often are you active?
Sometimes I take my dogs for a walk, like a couple times a week, and then when I have the time, I go to the gym. So I'd say I probably exercise like 3 or 4 times a week.
Okay, good. So pretty active.
Mm-hmm.
How many dogs do you have?
2.
Aw. Okay, so I'm just gonna start by getting your blood pressure. Okay, so I got 114/76. Would you say that that's about normal? That's what your blood pressure normally runs?
Yep, that's about normal.
All right, great. Well, it is below 120/80, which is what we like to see in healthy people. Now I'm just going to go get your temperature. All right, and it's 97.5, so definitely within normal range. The next thing that I'm going to do is just get your pulse. So I'm going to count this for a full minute. right, great. So I got a pulse of 68, which is good. We'd like to see that between 60 and 80 in healthy people. And then I had respirations of 16, and we like to see that between 12 and 20. Normally, I would get your pulse ox, but we don't have one of those with us today. But before I do that, I would want to look to see if you have any clubbing on your nails, which I don't see any. And then the next thing that I'm going to do is just check your capillary refill in both of your hands. And that is below 3 seconds, so that's good. All right, so the next thing that I'm going to have you do is just squeeze my hands for me. All right, great, and then put your hands out like this. Don't let me push in. Don't let me push out. All right, great. Now I'm just gonna start examining your arms. Just gonna roll this sleeve up. So right now I'm just looking for any moles or lesions or bumps to be concerned about. I see a few freckles, but nothing worrisome. And then I'm just gonna feel your arms for muscle tone and symmetry. Now I'm gonna take your radial pulses. And those seem strong and equal. Now I'm gonna move on to your brachial. Okay, and those seem strong and equal as well. The next thing that we're going to do is just some range of motion things with your arms. So if you could just swim forward for me, and then swim backwards. No pain there when you're doing that?
No.
And then if you could just lift your arms up like this. All right, great. No pain at all?
No.
The next thing that we're going to do is test your cerebral function. So if you just place your hands on your lap and then flip them back and forth as fast as you can. Great. And now if you could just make an okay sign and pretend like you're playing an instrument, going back and forth with your fingers as fast as you can. Great. So your cerebral function is perfect. The next test that we're going to do is I'm going to place my hands on your shoulders, and if you could just shrug up. All right, so that was testing cranial nerve 11, which is your accessory nerve, just making sure that all the muscles in your shoulders and part of your back are working properly. So I think that that is it for the arms. The next thing that we're going to do is look at your face. So everything seems symmetrical. I don't see any abnormalities to be concerned about, no lesions or anything like that. So the first test that I'm going to do is I'm going to take this Q-tip and touch it in different places of your face, and you just tell me where they are. So I'm going to have you close your eyes.
Okay. Forehead, left cheek, chin, right cheek.
All right, great. So that was your trigeminal nerve, which is cranial nerve number 5, just testing for the sensation in your face. The next nerve that we're going to check is cranial nerve number 7, which is your facial. I'm going to have you make some faces for me. So if you could smile and frown and puff out your cheeks and raise your eyebrows. All right, awesome. So everything seems good there. The next thing that I'm going to do is have a look at your head. So I'm going to start by just palpating down your head, feeling for any bumps, which I don't feel any. The next thing that I'm going to do is just go through your scalp and see if there's any irritation or dryness. Have you had any dryness recently or itchiness?
No.
Okay. Well, everything looks good over here. And I don't see any lice to be concerned about. Scalp looks really healthy. So that's good. The next thing that I'm going to do is I'm just going to reach behind your head and palpate your occipital lymph node. And then everything's good when I'm doing this. No pain or tenderness here.
Nope.
All right, great. Then with that, I think we can move on to the eyes. So the first thing that I'm going to do is just pull down your eyes and have a look. So your sclera is white, normal. And then can you just look up? And your conjunctiva is pink, no redness or irritation that I see there. So now we're just going to do a couple of tests with your eyes. I'm going to be shining my light in your eyes and looking for pupil constriction. So first I'm testing direct, seeing what happens when I shine it right in the eye. And then I'm going to test consensual, shining it in one eye and looking at the other. Okay, great. The next thing that I'm going to have you do is just follow my pen with your eyes without moving your head. Okay, great. So now if you could just place your finger on your nose and then touch my pen, and then on your nose, and then touch my pen, on your nose, touch my pen, and then on your nose, and touch my pen. Okay, everything with that is good. Now I'm just going to have you focus on my pen, and then look at the wall behind me, and then on my pen, and then at the wall behind me. Alright, well everything looks good there. Your pupils are equal, round, reactive to light, and they accommodate with distance. So all of those tests that we were just doing, that tests your cranial nerves 3, 4, and 6, which is your oculomotor, trochlear, and abducens. So everything with your eyes is good. Would you say that you have pretty good vision?
Yeah.
Haven't experienced any drainage from your eyes recently?
No.
No irritation or dryness? Okay, that's good. So the next thing that we're going to look at is your nose. So I'm just going to have you tilt your head up for me. You haven't had any irritation or dryness, stuffy nose lately?
Mm-mm.
Alright, well your nasal mucosa is pink, normal. I'm just looking for any polyps, but I don't see any. No lesions to be concerned about. So that's good. The next cranial nerve that we're going to test is olfactory nerve 1, which is just your sense of smell.
Mm-hmm.
So I'm going to have you close your eyes for me, and then I'm going to give you a smell, and you tell me what it is.
Vanilla?
Yep, perfect. So your olfactory nerve is functioning properly. The next thing that I'm going to do is just palpate some sinuses on your face. So the first one that I'm going to start with is your frontal, just on your forehead. No pain there?
Nope.
And then moving on to your maxillary. And then no tenderness or irritation when I'm doing that one?
No.
Okay, great. So everything looks good there. The next thing that we're going to do is have a look at your mouth. So if I could just have you stick your tongue out, getting my tongue depressor here, and say ah. Okay, great. So that was just testing cranial nerve 9, which is your glossopharyngeal nerve. It's just making sure that your phonation is working properly, or your speech. Then I'm just going to have another look inside there. And then lift your tongue up for me. And then back down. And then can you wiggle it side to side? Okay, great. So that was testing your hypoglossal nerve, which is cranial nerve 12, testing the muscles in your tongue, and that seems to be working fine. Your oral mucosa looks pink. I don't see any lesions or abnormalities to be concerned about. Have you had any pain with your mouth recently?
Mm-mm.
No bumps or anything?
No.
All right, that's good. And then the last test that I want to do with your mouth is just if I could have you swallow for me. All right, and that was just testing cranial nerve 10, which is your vagus nerve, just making sure that you can swallow. So everything looks good with your mouth. The next thing that I'm going to do is have a look at your ears. Do you have any trouble hearing at all?
No.
All right, so I'm just going to inspect, look behind the ear. Don't see any redness or anything. I'm going to start palpating at the pinna and work my way down. You just tell me if you feel pain. No pain there at all?
No.
Okay, great. And then I'm going to work over to this side. Just inspecting, looking behind the ear. just going down the ear now, starting at the pinna. All right, and everything feels normal, and you haven't had any drainage coming from your ears recently, no pain?
No.
All right, great. So the next thing that I want to do is just palpate your pre- and post-auricular lymph nodes. So I'm starting here at the pre-auricular, right in front of your ears. No tenderness here.
No.
And then just going to the post-auricular, right behind the ears. And then still no pain there?
No.
All right, great. So the next thing that we're gonna do is just have a look at your neck. So right now I'm just inspecting the trachea. Everything looks good there. I don't see any abnormalities with the neck. And now I'm going to listen to your carotid arteries for bruits. So I'm going to be doing that listening with my bell. So it would be a whoosh sound. So we like to hear nothing when we do this. Starting on this side. All right, and then just moving on to the other side. Okay, great. I don't hear anything. Now I'm just going to feel your carotid pulses one at a time. If you do both, you might pass out. All right, seems strong on that side. And also strong on this side. And now I'm just going to palpate the rest of your lymph nodes. I'm going to start at your submandibular right here underneath your jaw. You just tell me if you feel tenderness with these. All right, everything feels good there. Moving on to your submental right below the chin. So I don't feel anything there either. And now I'm just going to work my way down your cervical chain. And I don't feel anything there as well. All right, and then I'm just going to pull down your gown here a little bit and pinch at your clavicle right here. Just a little bit of skin, it shouldn't hurt. Just checking your skin turgor, making sure it's not tenting, which it isn't. It goes right back down, so that's good. I'm just going to have a look at my sheet and see if I missed anything before we move on. Okay, well, I think that we are doing okay so far. So if you're comfortable, I'm going to have you turn around.
Okay.
So that we can inspect your back. So the first thing that I'm going to do back here, just going to untie your gown if that's okay.
Yeah.
All right, so I'm just going to reach around your neck. Don't be alarmed. I'm just feeling your thyroid right now. Do you have any issues with your thyroid as far as you're aware?
No.
All right, great. So the next thing that I'm going to do is just have a look at your back, making sure that there's no moles or lesions, bumps to be concerned about, which I don't see any. And next I'm just checking the alignment of your spine. And that seems straight. No issues there at all. Do you ever have any back pain?
No.
All right, great. So the next thing that I'm going to do is I'm just going to percuss 6 spots on each side, so 12 in total. Just listening for tympany, making sure that there's no fluid in the lungs. So I'm going to start over here. All right, and then I'm just going to go under your bra a little bit. And I'm just going to lift it up a little bit. All right, so I definitely hear timpani, no issues there. The next thing that I want to do is test you for barrel chestedness. So I'm going to put my hand in front of your chest like this, and then on your back, and then on the sides. And it looks like you do have a 2-to-1 ratio, which is good. 1-to-1 ratio would be a symptom of barrel chestedness. And then before I listen to your lungs, I just want to check your chest expansion. So if you could just take a deep breath in for me. All right, great. And your chest expansion seems equal. I'm just gonna make sure this is still recording. The screen turned off. Okay, good. All right, so now I'm just gonna listen to your lungs in the same 12 spots as before. Listening for clear sounds, making sure there's no crackles or wheezing. Do you have any issues breathing, any asthma?
No.
Okay. All right, so just tell me at all if we need to take a break with this. I'm just gonna have you take a deep breath in and out and 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 in and out. Just gonna go underneath your bra over here and in and out and in and out and in and out, in and out, in and out, and then last one, in and out. Okay, so everything in your lungs sounds great. So if you want, you can actually lay down for me. We're gonna listen to your heart now. Okay. I'm gonna grab the computer so you can hold it. All right, so if you wanna just hold this for me. All right, so I'm just gonna take your gown down a little bit, try not to expose you too much. Right about there. So we're just listening on different spots of the heart, and I'm gonna be listening with my diaphragm and my bell. So once again, just listening for bruits, making sure we don't hear a whoosh. So the first place that I'm gonna start is the aortic, which is 2 intercostal spaces down. So about right here. All right, sounds good. Just listening for bruits now. Okay, don't hear anything. Now I'm going to move on to the other side, counting 2 intercostal spaces down. 1, 2. Right here, this is going to be your pulmonic. All right, awesome. Hearing that lub dub. Flipping it around to my bell now. All right, don't hear anything there. So now I'm going to move down to your herbs, which is 3 intercostal spaces down. 1, 2, 3. Going to be right there. Sounds nice and strong. Gonna flip it around to my bell. Alright, great. The next one that we're gonna do is the tricuspid, which is 4 down, 1, 2, 3, and I'm just gonna reach underneath so that we don't expose you here. So it's right underneath your bra right here, so I'm just gonna put it right there. Okay, sounds good. I'm gonna flip it to my bell now. Going in the same spot. Alright, and I don't hear anything there. So keeping my finger there at the tricuspid, at the 4th intercostal space, I'm going to move down to the 5th intercostal space, which is about right here, and that's going to be your mitral. So just putting my stethoscope right there. I'm going to flip it around. Alright, there we go. So right under your boob. Now I'm going to count for a full minute and get your apical pulse. Alright, so I got an apical pulse of 72. Just gonna flip it around and listen with my bell at the mitral now. Alright, and I'm not hearing any issues there. I'm just gonna cover you up really quick. While I have you laying down, I'm just going to check for any jugular vein distension. I forgot to do that before we did the heart sound. So if you could just turn your head that way for me. Don't see anything over there. And then just turn towards me. Alright, great. Nothing over there. Alright, so now we're going to do your abdomen. So if you could just lift this up for me. Great. Alright, and then I'm just going to have you hold the computer this way. A little bit like down more. Or actually, you can hold it like that. I'll just angle the screen more maybe. Okay, yeah, that looks about good. I'm just going to put these down more a little bit so that we can do the assessment. The first thing that I'm going to do with your stomach is just inspect, making sure that there's no bumps or abnormalities. No lesions, moles, anything like that. I do see that you have a belly button piercing. Have you had any issues with that?
No, I have not.
Okay, good. Alright, so after inspecting, I don't see anything wrong. So now I'm just going to listen for your bowel sounds. So I'm going to start in the right lower quadrant, just listening for 5 before I move on. Alright, moving on to the right upper quadrant. Going to the left upper quadrant. And then the left lower quadrant. Okay, so the next thing that I'm going to do is just listen to different arteries in your abdomen. I'm going to listen with my bell, once again, just listening for bruits. So the first one that we're going to start with is your aortic, which is about right here. Alright, and I hear nothing, which is good. The next one we're going to do is your renal, which is right above your belly button, 2 on each side. And then moving to the other side for renal. And then moving down to your iliac, which is right below your belly button. And then to the other side for iliac. Alright, and since we're already here, I'll just angle it up a little bit. Yeah, that's fine. So since we're already here listening for bruits, I'm just gonna check for femoral bruits as well. So this is gonna be right in the crease of your leg.
Okay.
So I'm just gonna lift your shorts up here to maintain privacy. Okay, and then just going to the other side. Alright, great, nothing there. So now we can look back at your abdomen. Yeah, you're good. So the next thing that I'm going to do is just percuss your abdomen, same thing that we were doing with the lungs. So I'm going to do it a couple times for each quadrant, listening for tympani. And then once we get to the right upper quadrant, we'll start to hear some dullness right by your ribs. So right about there. And that's going to be your liver. So your liver's about right there. Alright, moving on to the left upper quadrant. And then the left lower. Alright, so everything sounds good when I was percussing it. The next thing that I'm going to do is just some palpation. I'm going to start light and then go deeper. You just tell me if you feel any discomfort when I'm doing any of this.
Okay.
So starting out light. Starting in the right lower, going to the right upper, then to the left upper quadrant, and then to the left lower quadrant. Alright, and then I'm going to go a little bit deeper now. And then when we go a little bit deeper, you can sometimes feel the outside of the liver, right by your ribs. Okay, going to the left upper, and then the left lower quadrant. Alright, well everything seems good with your stomach, so I'm just going to pull that down for you. And then set this back up so that you don't have to hold it. I'm just gonna plug it back in. Okay, so the next thing that we're going to be looking at is your legs. Just how I listened to the femoral arteries, I'm now just going to palpate them and make sure that they're equal and strong.
Okay.
So, okay, and they seem equal and strong as well. Alright, so the next thing that I'm going to do is just inspect your legs. So I do see some freckles, no moles to be concerned about. I do see a bruise. Do you know what that's from?
Probably playing with my dogs.
Oh, okay. Yeah. I do see that you have a tattoo right here. Have you ever had any issues with that?
No, I've had it for like 2 years. So.
Oh, okay, good. So now I'm just going to feel your legs for temperature. They're warm, and I don't see any swelling, so I don't suspect any edema. Okay. Now I'm just going to feel a few pulses throughout your legs. The first one that I'm going to start with is your popliteal, so I'm just going to have you lift your knees up for me. Try to find it. It's hard. Alright, and those seem strong and equal. You can relax your legs. I'm just going to take your socks off to do the other two. Is that alright with you?
Yeah, that's fine.
Okay. So now I am just going to feel your dorsalis pedis, which is at the top of your leg right here. And that feels strong as well. And then just going to your posterior tibialis, which is your ankle. And that seems strong as well. Do you have any issues with your circulation?
No.
Okay, good. So I'm just going to check your capillary refill in your toes.
Okay.
Make sure that you are getting enough circulation. And I don't see any issues. It refills less than 3 seconds, so that's good. Now we're just going to do some range of motion tests with your feet.
Okay.
So if you could just push against my hands and then push down like a gas pedal and then to the sides and then inward. Alright, good. So everything's looking good there. The next test that we're going to do is testing for sensation in your legs. So I'm just going to take this fork and I'm going to be putting it in places on your thighs, your shins, and your feet. And you're going to tell me if it's sharp or dull.
Okay.
So this is sharp.
Mhm.
And this is dull.
Okay.
Alright, so close your eyes for me.
Sharp left shin.
Great.
Dull right thigh. Sharp left thigh. Dull right shin.
Good.
Dull left top of foot. Dull right bottom of foot. Dull right top of foot. Dull left bottom of foot.
Alright, great. So everything looks good there. Just gonna put your socks back on. Okay, great. So whenever you feel comfortable, I'm gonna have you sit up for me. Okay, great. You're not feeling lightheaded, dizzy, anything like that?
No.
Alright, well I'm gonna give you a second to get your gown on. We're almost done. Okay, so if I could just have you scooch off the bed a little bit. We're gonna be testing your patellar reflex. So I'm just going to be taking the end of my stethoscope because we don't have the proper utensil here. And I'm just going to be hitting this against your knee, making sure you kick out, testing that reflex. So that one's working. All right, it looks good in both of the legs. And you said that you aren't feeling dizzy at all?
No, I feel good.
All right, so then whenever you're ready, you can put on your shoes for me.
Okay.
All right, awesome. And then when you're ready, I'm going to have you stand up. We're going to do a Romberg test. So if you could just close your eyes for me and put your hands at your sides. And we're just testing for swaying, making sure that you have balance before we test your gait. And this is testing cranial nerve number 8, which is your vestibular cochlear. And I don't see any swaying, so you can open your eyes if you want. Everything looks good there.
Okay.
So do you feel okay to walk?
Yeah.
All right, so I'm going to have you just normally walk this way for me. And then just walk back heel to toe. All right, no issues there.
No.
If you want, you can have a seat back down for me.
Okay.
All right, so the last thing that I wanted to do was test you on the Braden scale, which just assesses for pressure ulcers. During my assessment with you, I didn't see any shear or friction problems. I don't see any moisture problems, any incontinence that I'm aware of.
Mm-hmm.
When we were going through all of your cranial nerves, they were functioning perfectly fine. So I think that your sensory perception is pretty good. And then you said that your activity level, you work out a few times a week, you walk your dogs, so that's great. And then you eat all your meals, you said, and pretty good diet. So for that, I would give you a 23 out of 23, which is what I would expect for someone like you and your age. So yeah, you have a perfect Braden scale. Do you have any questions about your head to toe assessment today?
No.
Okay, great. Well, I'm just going to check my sheet one more time, make sure that I'm not missing anything before we end this.
Okay.
Okay, well, I think that is it for the head to toe check off. So thank you for being my patient.
You're welcome.
All right, yeah. And that concludes my head to toe check off.